Let me check. We have a very exciting podcast coming up. So just hold on. Let me check. Okay, great. So hello everyone. So welcome to another podcast of Rewarding Health. So today हमारे साथ एक डॉक्टर जुड़ने वाले हैं फ्रॉम हैदराबाद, डॉक्टर अभिलाष बैनर्जी. तो बेसिकली मैं आपको आपको शायद हमने ऑलरेडी मैसेज तो कर दिया था कि वी आर कमिंग अप ऑन द टॉपिक ऑफ कैंसर, राइट. कैंसर एक ऐसा वर्ड है जिसको हम सभी सुनते हैं तो वी गेट लिटिल स्कैर्ड, राइट. बट द होल आइडिया बिहाइंड डूइंग दिस पॉडकास्ट इज टू क्रिएट दैट अवेयरनेस कि कैंसर इज समथिंग विच कैन बी प्रिवेंटेड, कैंसर इज समथिंग विच कैन बी बिटन, राइट. मतलब हम ओवरकम कर सकते हैं कैंसर को भी. And definitely we will know more about it. So let me welcome Dr. Abhilash, who is a budding oncologist currently working at Yashoda Hospital, Hyderabad. So yes, hi Abhilash.
Hi, Tina. How are you?
Yeah, I'm doing great. How are you doing?
I am doing great.
Okay, great. So thanks for taking some time out and coming here.
It's my pleasure, and thank you to you guys that you guys invited me. It's an
Yes.
interesting topic actually, and people should know more about it.
Absolutely. This is a very, very interesting and important topic.
Yes.
So, we are going to discuss here. So before I go ahead, Abhilash, if you give us a quick background about yourself, a one or two line about
Uh, I am Dr. Abhilash. I am actually from Kolkata, but currently right now I am in Hyderabad and I'm in Yashoda Hospital, Somajigoda, and I'm mainly an oncologist and I practice in the field of cancer and mostly the non-surgical parts. We have our surgical parts also. That surgical oncologists they deal with the surgical parts of the cancers where it can be resected. Then we have medical oncology and radiation oncology. My specialty is in the radiation field, the
oh,
radiation oncology.
okay, great, great.
Yeah.
So cancer, जो मैं अभी अपने audience को बता रही थी. So basically our
Hmm.
audience is different. They belong to different parts of India. तो हम लोग
Hmm.
both हिंदी और इंग्लिश में conversation करेंगे आज.
Sure. I'm fine with both the languages.
या सो पहले टू स्टार्ट ऑफ
Hmm.
कैंसर, ये इसको अगर इजी लैंग्वेज में हमारे ऑडियंस के लिए इफ यू कैन जस्ट एक्सप्लेन व्हाट इज कैंसर.
Cancer is like how मतलब नॉर्मल सेल्स जो होते हैं बॉडी में दैट डिवाइड्स नॉर्मली जैसे हमारा हाइट बढ़ता है छोटे मतलब वन स्मॉल बेबी ग्रोस तो इट ग्रोस ग्रेजुअली हाइट इंक्रीज होना या फिर कोई अगर वुंड हो रहा है तो वो हील होना दैट इज नोन एज नॉर्मल सेल सेल रिपॉपुलेशन और सेल रिप्रोडक्शन. ये अगर इसका रेट अगर अनकंट्रोल्ड हो गया तो इट ग्रोस सो रैपिडली दैट इज नॉट इन अ कंट्रोल ऑफ आवर बॉडी. So body cannot control it. Any uncontrollable growth, any cell that is coming with an uncontrollable growth is called as cancer. Because the problem with this type of cells are that body is unable to control this. So they have their own control. It's like you have lost the pilot. Now the plane is flying on its own and it can go anywhere. It is not a fixed destination anymore. Problem is ये cell ये मतलब कोई अगर कैंसर मतलब बहुत कॉमनली जो हम लोग सुनते हैं लाइक कैंसर फैल गया तो फैल गया मतलब क्या है डिवाइडेड सो रैपिडली वो बाहर चला गया ब्लड के थ्रू कभी लिम्फ ग्लैंड्स के थ्रू लिम्फ फ्लो के थ्रू बहुत other routes are also there locally. It can spread to anywhere. So it grows and it causes various symptoms because of the compression, because of the normal जो जहाँ पर ये grow कर रहा है that functionality also goes down. Like lung में होगा तो वो lung का लोब काम नहीं करेगा. Plus along with that वो जो like जिस area में है that area will also get pressure effects of it. And plus sometimes it secretes something also like कोई cancer ऐसे ऐसे like we call it paraneoplastic syndrome like small cell lung cancer बोल के है जिसमें like we get cortisol levels high तो कुशिंग syndrome होने के chances होते हैं कभी कभी we get neurological features that are also part of वो थोड़े rare है but ये थोड़े common है. So in one word I will be saying uncontrollable like growth of the cells.
अनकंट्रोलेबल ग्रोथ ऑफ द सेल्स इन एनी पार्ट ऑफ द बॉडी.
Yes.
जिस
Yes.
पार्ट में होता है उसी को कैंसर हो जाता है, वहीं पर
Yes.
कैंसर हो जाता है. सो
Yes.
तो
Yes.
क्या क्या डिफरेंट टाइप्स ऑफ कैंसर है एक्चुअली, क्या क्या होता है कॉमन कैंसर्स.
Common cancers, बेसिकली हम लोग जैसे डिवाइड करते हैं सॉलिड ट्यूमर्स और ब्लड ट्यूमर्स, ब्लड कैंसर्स. सो
हम्म,
सॉलिड एंड ब्लड आर लाइक सॉलिड ऑर्गन्स में जो होते हैं, लाइक टंग में होता है, कभी लंग में होता है, तो ऑल दीज आर कॉल्ड सॉलिड कैंसर्स. और
हम्म,
ब्लड में जो होता है लिम्फोमास, ल्यूकेमिया, दो आर कॉल्ड ब्लड कैंसर. आई एम
ओके,
जस्ट गिविंग ग्रॉस ओवरव्यू.
या,
और ऊपर से देन देर आर लाइक पैथोलॉजी वाइज भी देर आर क्लासिफिकेशंस, लाइक वी कॉल देम, सम आर कॉल्ड स्क्वामस सेल, सम आर कॉल्ड adenocarcinoma. That are more core of medical topics that
तो
might not help that much.
या सो जो मैंने सुना है, देयर इज अ लंग कैंसर, देयर कैन बी स्टोमक
Hmm.
कैंसर, राइट?
Hmm.
देयर कैन
Hmm.
बी माउथ कैंसर, जो आपने बताया,
Yes, yes,
माउथ
yes,
कैंसर. सो दीज
yes.
आर कॉमन कैंसर्स, एंड देन a lot of breast cancer, है ना, यूटेरस कैंसर.
हाँ.
सो देयर आर लॉट ऑफ कैंसर, दीज आर कॉल्ड सॉलिड कैंसर, इज इट, व्हाटएवर
Hmm.
यू टॉक.
Hmm. Hmm.
बाकी जो
Yes, yes.
ब्लड में होता है, राइट? ठीक है, ग्रेट. सो नाउ तो क्या जो सबसे ज्यादा कॉमन कैंसर, ऐसा कोई कैंसर है क्या जो बहुत कॉमन है?
इंडिया में सबसे ज्यादा कॉमन कैंसर राइट नाउ इज ब्रेस्ट कैंसर,
ओके,
along with in whole world also this is a breast cancer, because the sheer number of population is way too much huge. And that's why like you'll see all this like all the screening camps, sometimes along with that screening camp sometimes they are trying to preventive measures, mammogram वगैरह जो भी है ये, मतलब कैंसर प्रिवेंशन का मेन एम है. ब्रेस्ट कैंसर को मतलब the numbers को should go down, because the treatment is very good right now, and like anybody who gets diagnosed with breast cancer can be treated in an early stage. It is curable, actually we can say one of the curable cancers. And late
ओके,
stages में भी like other cancers में 5 years, like एक lung cancer का 5 years survival अभी better है, अभी बहुत ज्यादा better हो चुका है. Cancer treatment has increased, like they have evolved like anything. Cancer treatment every single day is evolving ना, तो the lifespan is increasing. Stage 4 में पहले हम लोग 6 महीने तक नहीं like expect करते थे. Right now we're seeing 6 years, 5 years. So this is increasing. As for breast cancer, it is very huge. So breast cancer is very important.
ओके. सो ओके, ग्रेट. सो ब्रेस्ट कैंसर बहुत कॉमन है, तो डू यू नो
Yes.
एनी कॉजेस, लाइक कैन यू शेयर एनी कॉजेस जिससे पता चल रहा है कि ब्रेस्ट कैंसर इतना प्रिवेलेंट हो रहा है, इतना ज्यादा हो रहा है?
Like breast cancer के causes, so there are a lot of causes. It can be, but we will divide into, मेरे हिसाब से preventable and non-preventable type के causes को divide करना चाहिए. Non-preventable means you don't have any control over it. Like genetics, if some first degree relative had breast cancer, that is not in our control. Like if somebody's mom had cancer, that is not in our control. But on the other hand, some factors that are related to, like you have control over it, they are called like modifiable factors. You can modify those things. Those things should be discussed, I believe. And एक सबसे ज्यादा important है obesity. Obesity is one such cause. Breast cancer, मैंने अभी बोला ना, breast cancer is very common. Obesity is also very common. Both links are there. So
ओके.
if somebody is obese, there are a lot of mechanisms undergoing. Just मतलब around the age of 40s, around the age of 50, the patient can have breast cancer.
ओके.
Along with that, हम लोग बोल सकते हैं like late childbirth is another cause. Like some people like prefer to have the delay their first child a
या.
lot. So delay their first child. मतलब the thing is, the more we have the exposure of estrogen, the more chances of getting breast cancer.
ओके.
Along with that, habits like what are the risk factors of PCOD? PCOD is a very common disease. They
करेक्ट.
are sometimes related to breast cancer also. Along with that, if your relatives are involved, genetic risk factors are there. Some other factors are also there. OC pills. Some people take OC pills like there should be,
कंट्रोल.
yes,
ओके.
yes, those are causes.
ओके. सो मैं ओबेसिटी पर आने वाली, पर बिकॉज़ यू टॉक्ड
Hmm.
अबाउट ब्रेस्ट कैंसर, तो ऐसा क्या
Hmm.
सिम्पटम्स है जो लड़कियों को पता दे, मतलब दे कैन अंडरस्टैंड कि मे बी आई एम गेटिंग ब्रेस्ट कैंसर? कुछ ऐसा सिम्पटम्स आप बता सकते हो?
Uh, Mostly they usually present with breast lumps.
ओके.
So chota lump ho, any hard lump usually gives the suspicion of having breast cancer. Young age में थोड़ा ये rare है, like if we don't expect this in 15 to 20 years, but anybody like above 25 in the 30s range, right now it is very common in that early age also. So the thing is, anybody who is coming up with a breast lump or any solid lump should get evaluated by not only an oncologist. Anybody can examine it and at least tell you like it is cancerous or not. Then they can refer to an oncologist. First thing is, don't you the person should not be scared that it's a breast cancer. The
या.
first thing should be, we should get it checked. Along with that, there can be some discharges sometimes in advanced diseases, like they can see like bloody discharge coming out. So both usually they attract eyes and they go for doctors. But the
Yeah.
small tiny lumps sometimes goes unnoticed. So occasionally, what they can do is like as a doctor, I can advise like they can go for like self breast examination. We teach our patients also that, so they can while taking a shower also they can examine their own breast. All the ladies around 30s should
Mhm.
see for any nodularity or anything abnormal is there or not. If there is
Mhm.
anything abnormal, they can just get it checked.
Okay, so then we should go for a normal general doctor first.
Yes, normal general doctor. If you have a oncologist available, then why not? Because they will be like one shot. Because India is not based on that system. Like in UK, what we practice is like first the patient goes to GP, then the patient gets referred. India में ऐसा कुछ नहीं है. They can come to oncologist if their city is having that. But sometimes all the tier three cities might not have an oncologist.
Correct. Yeah, yeah. And people are sometimes, girls are sometimes they're not,
Huh. They're
comfortable.
more shy. They're more
Yeah,
shy. Finding a girl oncologist is a tiny bit difficult. They can
correct.
first go to a gynac.
Yeah, yeah. So the sonography can detect that nodules or
Sonography can detect it. Right now, we have the breast cancer screening tool. We have a thing called mammogram and screening ultrasound sometimes. Mostly mammograms. Mammogram is a form of X-rays. Like
okay.
that will take high quality X-rays with less
Mm,
X-ray exposure. Like if we are using something for screening, that X-ray exposure, like the radiation exposure has to be less.
okay.
So mammogram has that very less. So we are using that also for screening. They can go for it.
Okay, great. So this was a very important information for all the women, 30
Mm.
plus, because yes, it is becoming more and more. We are often we हमें हमें सुनाई देता है कि काफी breast
Mm.
cancer cases के बारे में. So that was quite great information. Coming back to the obesity related question जो आपने बताया था कि connection
Mm.
between obesity and cancer risk है ना? तो
Mm.
obese होने से कौन सा कैंसर ज्यादा होने का चांसेस है?
Actually, there are a lot of cancers. Like ऐसा कुछ नहीं है like only one cancer develops from obesity. But
हम्म.
for like from considering like our population mostly it will be the breast cancer. Along with that, आपने जो बोला uterus का cancer, जो endometrium cancer बोलते हैं,
Men
that is
in
also
men.
related. In male, there is a thing called food pipe, esophagus बोलते हैं. Esophagus का जो lower part है, usually ये western knowledge में ज़्यादा common है, तो that is called adenocarcinoma of esophagus. That is also associated with obesity. Along with that, stomach cancer is also there. Like these are like any gastric pathway cancers can be associated with obesity.
Okay.
But mostly I will focus on breast cancer because there is a clear cut link and there has been a multiple amount of studies that shows that breast cancer can be developed from obesity.
Okay. Okay, because it is connected to estrogen, right?
Yes, yes, yes.
Okay, fine. So now, excessive alcohol. ये बहुत common
Mm.
trend हो गया आजकल, the Friday
Mm.
parties and alcohol has become very common. So does it has any relation with lung, and sorry, liver and liver cancer?
लिवर के साथ तो है ही like first of all like alcohol cancer तो will come later, other symptoms will come first, like it
Yes, yes.
causes direct liver damage, so it
Mhm.
can cause hepatitis chances are there. Along with that, it can cause fulminant hepatitis. The most important thing is it can cause liver fibrosis and cirrhosis, what we call as cirrhosis.
Yeah.
Cirrhosis is like you'll see a lot of patients with a lot of fluid in the abdomen, like पेट
Mm.
फूला हुआ होता है. गवर्नमेंट कॉलेज में आप जाएंगे तो येलो होता है, जॉन्डिस हो सकता है, सब कुछ हो सकता है. एंड अगेन ये ट्रॉमा अगर होता रहा लिवर को एंड दे आर अगेन गेटिंग चेक्ड, अगेन दे आर स्टार्टिंग अल्कोहल, तो दैट कैन लीड टू कैंसर्स.
Mm.
Hepatocellular cancers are very much related to alcohol consumption. But the thing is, hepatocellular cancer थोड़े कम नंबर में होते हैं. तो यूजुअली फर्स्ट जो कैंसर आएंगे, like usually what people do is when they're drinking, they're also having a smoke. So
Mhm.
smoking and drinking are most important cancers for our oral area, like tongue, the food pipe, along with the respiratory pipe, lungs. So not only like usually लोग सोचते हैं like alcohol मतलब liver cancers, like it is there, but these cancers are again more common. Like the thing is, अगर 100 पॉपुलेशन में 10 कैंसर माउथ कैंसर का हो रहा है तो दो तीन कैंसर होगा शायद लिवर कैंसर का. तो
Mhm.
ऑब्वियसली ये वाला कैंसर ज्यादा इंपॉर्टेंट है. तो पूरे एरियाज में लाइक टंग, ये like usually lower class people में तो मैंने ये notice किया like these cancers are more common because they are taking it together. So
Mhm.
these
Correct.
are there.
Correct. So you mean it starts from mouth cancer,
Yes, yes.
then
Mouth to
lungs.
whole tract is exposed to like the smoke. When people take a smoke and they take the drink, that
Mhm.
whole thing gets exposed. The whole area gets exposed. The whole area is chance of having a cancer.
Correct, correct. Because why I ask you this question is initial days, like 100 years back, maybe
हाँ.
cancer cases were at very late, like 70s,
हम्म.
80s में होता था, years में. अभी तो हो रहा है 40, टाइप में कैंसर डिटेक्ट हो रहा है, राइट? इफ आई एम नॉट रॉन्ग.
The main reason is the lifestyle change right now. Earlier, these things were not that much accessible.
करेक्ट.
The quality of the food, everything. Now the adulteration has also come. Right
हम्म.
now, if somebody asks me what is the risk factor for cancer, I have to say everything is a risk factor for cancer. Like the going through normal road, the air pollution we are getting exposed, that is also a risk factor for cancer, lung cancer.
ट्रू. सो सेम लाइक अल्कोहल, शुगरी फूड्स या प्रोसेस फूड्स आजकल काफ़ी एक्सेसिबल हो गया है. क्योंकि मैंने सुना है कहीं पर कि शुगर इज़ फूड फॉर कैंसर, है ना? तो आई एम नॉट श्योर,
Again,
मैं आपसे पूछ रही हूँ. तो सो ज़्यादा प्रोसेस फूड बाहर खाने वाले लोग, ज़्यादा ऑयली फूड खाने वाले लोग, इन लोगों को क्या प्रोन आर दे प्रोन टू लिवर और एनी टाइप ऑफ कैंसर?
cancer, all these things are first gonna cause some sort of liver damage. All these foods, like, and plus we have already said like they will cause heart damage. अब
हुँ.
मेरे कैंसर आने से पहले द पेशेंट विल डाई आउट ऑफ हार्ट अटैक. तो कैंसर तो बहुत लेट में आएगा ये सब खाने के चक्कर में. बट द थिंग इज राइट नाउ इफ वी आर ईटिंग ऑयली फूड, शुगरी फूड, व्हाट इट विल डू इज इट विल ब्लॉक द वेसल्स दैट आर सप्लाइंग योर हार्ट. वो आपने
हुँ.
सुना ही होगा मायोकार्डियल इंफेक्शन जिसको हम लोग हार्ट अटैक बोलते हैं, वो होता है. अलॉन्ग विद दैट द मेजर वेसल्स, अगर मेजर पाइप्स अगर क्लॉग्ड हो गई कोई मतलब कुछ से डेब्रिस से, तो द
हुँ, हुँ.
पानी का सप्लाई नहीं जाता. सेम वे ऑफ हार्ट का खुद का ब्लड सप्लाई नहीं आएगा तो हार्ट कैन सफर, हाइपरटेंशन, डायबिटीज, ये सब होता रहता है. उसके बाद तो कैंसर सब दे.
करेक्ट. ठीक है, तो आप वी कम बैक लाइक टॉक अबाउट द प्रिवेंशन पार्ट नाउ. सो
यस.
जैसे अभी आपने बताया कि कैंसर कैन बी प्रिवेंटेड. सो कैंसर क्या हम हेल्दी लाइफस्टाइल या अच्छे खाने से गुड हेल्दी खाने से अवॉइड कर सकते हैं या प्रिवेंट कर सकते हैं?
डेफिनेटली इफ द लाइक healthy khana matlab in the sense like it should be in balanced diet. Right now people are for losing weight, they're going for various crazy diets. You have
हम्म.
heard it, I think. So all those things, like all those crazy diets are not normal. Something that is like what we recommend, as any doctors recommend, like protein, fat, and carbohydrate should be equally there. Like normal 60 for 60 20 20 division should be there. Along with that, a person should have a daily proper exercise. This is very important. That will help the person to keep the weight in check. Along that, obesity component will go down, and the person, like all the heart disease होने के chances ये सारे भी कम होते हैं. Along with that, definitely the cancer risk goes down.
Yeah, I was
And plus, along with that, lifestyle should be modified. Like ye Saturday night parties, Friday night parties. Occasionally, people will go. We cannot ask people to stop it, but it should be limited. It should be limited to only maybe once in a month, twice in a month, like not more than that. People like, and the number of smokes, number of drinks, these are also a very important risk factor for developing cancer. So, and plus, yearly once health checkup should be done at least by a trained doctor. Then they can say if anything is wrong with them.
Yes. So, yearly health checkup means the basic blood test and all you are talking about?
Blood tests or any general examination. If the patient comes to any doctor and says that this is happening to me, they will just evaluate that area. अगर किसी को बोलने में कोई प्रॉब्लम हो रहा है या फिर they are having excessive cough can also sometimes trigger, like cough can show like in a very early symptom of a lung cancer. Very early symptom. Sometimes the patient comes with only cough and they ignore it for a long time. But just get a basic X-ray done will help the doctor to determine, because anything that gets diagnosed in an early stage has wonderful treatment options right now. The stage one, like 1 to 2, if somebody asks me, it comes at a stage one and they ask like, what is my 5 year survival? Like it is different for different cancers. But right now, if stage one ka koi patient, I'm just giving a gross idea. The 5 year chances of him surviving is 99%, right? 90 to 99%. On the other hand, if it goes to stage two, it drops down 10-20%, like it becomes 60 to 70%. So nearly we're talking about half chances है 5 साल जीने का. On the other hand, stage one में है तो 5 साल तो आराम से देखा the person can survive. So this that much difference at early diagnosis can help.
करेक्ट, एब्सोल्युटली. तो वही जो आपने बताया, किसी मेनी टाइम्स यू माइट हैव यू आर गेटिंग पेशेंट्स एट स्टेज 3 और स्टेज 4, है ना? तो जब आप पूछते हो,
India में this is more common actually.
yeah, people are not like they don't want to go, they just ignore whatever the reason. पर आप जब पूछते हो शायद तो क्या आपको ज्यादा सुनने को मिलता है? Why it happened? Like स्टेज 3 तक क्यों गए? बॉडी कुछ ना कुछ तो सिम्टम्स दिखाता ही होगा ना?
Mostly it's because of the ignorance and they're sometimes scared that the doctors kya bolenge. They're scared about the cancer treatment more than the cancer itself, because the stigma is like that. The moment I talk about radiation or chemotherapy, people start thinking that they will lose their hair, they will die because of radiation. One patient recently came and they were like, we are now using a for brain tumors. We are using a very fancy techniques called stereotactic radio surgery, that SRS, SBRTs we call them. So the patient said, like, I have heard that very high dose radiation might kill the patient, and here we are talking about a very small tumor that will be burnt by the radiation beam.
Chance.
But the thing is, maybe because of the stigmas, I don't know. Like, see the old treatments, like what I told in the like first few minutes of the discussion, like the old treatments of cancer and the new treatment of cancer are completely different right now. They have
Mm-hmm.
evolved a lot. They are they like the treatment options 5 years back and now are completely different. Like for as a like I'm always reading now. That's why I can tell you. Like 1 year back, what was the guideline for breast cancer is different now. So the thing is, people should not be scared. I think that is one thing. Along with that, sometimes like जैसे हम लोगों ने बोला like cough, normal cough है तो it will be in cold. बोल के they will take some over the counter medications. Like if you go to a medication shop, so they will give you some medications for cough. Cough syrup लेके you will lose the cough for 2 3 days. Like breast cancer का कोई lump है तो they will say that अभी तो छोटा lump है कोई नहीं बाद में देखते जब it will grow bigger. बट एनी
Mm-hmm.
छोटा बड़ा ऐसा कुछ साइज कट ऑफ नहीं है लाइक आफ्टर दिस विल गेट इनटू मोर डेंजर ऐसा कुछ नहीं है समटाइम्स लाइक पीपल सी लाइक इन द फीमेल ट्रैक्ट कैंसर लाइक एंडोमेट्रियम सर्विक्स इन सब में जो होता है लाइक यूट्रस कैंसर्स में दे विल समटाइम्स हैव ब्लीडिंग तो दे विल थिंक दैट इट इज नॉर्मल मेंस्ट्रुएशन कोई ब्लीड है तो गायनेक के पास जाएंगे if they go to gynec they will have to get checked but sometimes they don't go to gynecologists also they will go to some local physician or not even a doctor proper sometimes they will just get it checked by them or use some they will self medicate sometimes I have seen people using own drugs but wait like yearly once at least if you get a checkup done then you will get to know all those things early.
Hmm. Correct. So you mean to say we have to always observe the symptoms, है ना?
Yes,
Symptoms कुछ
yes.
भी हो सकता है वो
Any
थोड़ा
small symptoms should be checked.
या फॉर अ लॉन्ग पीरियड ऑफ टाइम जैसे कि कफ हो रहा है या फिर लम्प्स आ रहे हैं या स्टमक इन्फेक्शन सॉरी स्टमक कैंसर में कैसा होता है क्या यू कंटिन्यूअसली गेट लूज मोशंस और समथिंग हाउ somebody will know
No,
that my
stomach cancer usually presents with a loss of lot of weight loss. Like
mm-hmm.
a lot of weight loss along with the abdominal pain is the more common symptoms. And sometimes like loose stools तो नहीं होता है. Like stomach cancer का main problem is stomach is the like food bag of the body. Now that food bag means like it will help you like pass the food. It will help you digest the food and then push into the next thing. So when the stomach gets obstructed, the whole food comes out. So repeated vomiting हो सकता है. Vomiting ज्यादा common है. Vomiting बार बार कोई reason छोड़ के like the patient is having a lot of vomiting.
Yeah.
And also the patient is losing a lot of it, like 10 kilos, 15 kilos in 1 month. ऐसा भी
Mm.
होता है कभी कभी. A lot of it is not possible by weight loss programs. ना? So
Correct.
they should be alarmed that कुछ ना कुछ तो wrong है.
या ठीक है सो बेसिकली द आइडिया इज बॉडी विल कीप ऑन गिविंग सिम्टम्स
Yes,
है ना
yes,
सिम्टम्स देगा ही हमें उसको इग्नोर नहीं करना है एंड वी शुड गो फॉर अ चेकअप ठीक है
yes, yes.
सो नाउ कमिंग टू क्विकली टू पीपल हु आर सफरिंग फ्रॉम कैंसर राइट अगर
Hmm,
किसी को कैंसर हो गया है ना तो
hmm,
और वो ओवरवेट भी है ठीक है तो
hmm.
क्या इसका कैंसर ट्रीटमेंट के साथ थोड़ा उस ट्रीटमेंट को आउटकम में इफेक्ट होता है क्योंकि रिसेंटली रिसेंटली एक हमारी बेनिफिशियरी वेट लॉस बेनिफिशियरी ने
Hmm.
मैसेज किया कि उसकी मम्मी को कैंसर हो
Hmm.
गया है आई थिंक यूटेरस कैंसर और समथिंग या यूटेरस कैंसर
हाँ
एंड द डॉक्टर टोल्ड टू लूज वेट फॉर कैंसर ट्रीटमेंट सो दैट इज व्हाई आई एम आस्किंग दिस क्वेश्चन कि आउटकम में ओबेसिटी की वजह से इफेक्ट होता है
हाँ like all three parameters में like uterus cancer का जैसा treatment है uterus cancer first will be operated first will be stage होने के बाद will operate will that is called THBS total abdominal hysterectomy by so, like ovaries को remove करना is based on a surgeon but they usually do that उसके बाद based on the pathology report if it is a high risk tumor will add chemotherapy radiotherapy this is the usual protocol but इसमें problem क्या होता है if you are going for surgery the dose of anesthesia also depends on the weight they will calculate on the basis of weight अगर weight ज्यादा है तो more anesthesia will be needed weight ज्यादा है तो the post op complications होने के ज्यादा chances है even like the post op healing period में like the patient who is thinner will recover faster than a obese patient ये सब तो हो ही गया ये सब ओके ये सर्जिकल पॉइंट ऑफ व्यू से नाउ कमिंग टू आवर पॉइंट ऑफ व्यू लेकिन इफ एन रेडिएशन oncologist sometimes them will have advanced machines like MR-Linac right now. So those MR-Linac have their small bores. So the patient won't be fitted to that bore. तो हम लोग radiation treatment deliver नहीं कर सकते. ये तो एक है extreme cases हो गया. ऊपर से the problem, major problem along with that, whenever we are giving chemotherapy, we calculate the dose of chemotherapy based on the weight of the patient. So if the weight of the patient is more, so the dose of the chemotherapy is also more.
ओके।
Anesthesia का ज्यादा डोज होना is still okay, but chemotherapy का ज्यादा डोज होना मतलब chemotherapy related side effects will also be more. So that is a
अच्छा।
big problem. Like the whatever the things are like no, most common thing like side effects of this like endometrium tumors ये जो भी बोले यूटेरस कैंसर के जो भी कीमो देते हैं उसका जो मोस्ट कॉमन साइड इफेक्ट है वो है बोन मैरो सप्रेशन होना लाइक द ब्लड काउंट्स विल गो डाउन वॉमिटिंग ये सब so all this will be more in a obese patient. So
करेक्ट।
they should lose weight. So we also recommend our patients to lose weight first. And at the end of the day, मैंने आपको बोला पहले ही like the uterus cancer is directly related to along with breast, uterus cancer is directly related to obesity. So if they lose weight, hormone therapies will also work better. So many things are there.
ओके। ओके। ठीक है। सो अगर नेक्स्ट क्वेश्चन इज, अगर थर्ड या फोर्थ स्टेज में किसी को पता चलता है कि
Hmm.
दे हैव कैंसर, तो एज अ डॉक्टर लाइक क्या माइंडसेट आप बोलोगे उनको कैसे लुक फॉरवर्ड करना है आजकल के मेडिकल मेडिकल फैसिलिटीज के लिए? यू हैव ऑलरेडी मेंशन, बट अगर इफ
Hmm.
यू हाउ दिस वुड, कितना पॉजिटिव रहना चाहिए या कैसे
First
माइंडसेट को
of
आगे बढ़ाना चाहिए?
First of all, stage 3 is still considered as पूरे बॉडी में नहीं फैला है. Stage 3
ओके।
is considered as local areas में फैला है. Like if you're talking about lung cancer, तो just आजू बाजू ही it is spread. तो we'll call it as stage 3. Stage 4 means बॉडी के बाहर का ही चला गया. तो stage 3, stage 4 में usually there is a lot of difference. Stage 4 is
ओके।
usually the bad ones. Stage 3 still can be treated. मतलब क्यों हम लोग अलग करें इन लोगों को. स्टेज 3 कैन बी ट्रीटेड विद डेफिनेटिव इंटेंट. मतलब we're still trying to cure the cancer. May not be 100% cure, but 90% cure करने की like we're trying it. On the other hand, stage 4 it boldly becomes we're trying to just control the symptoms and give the patient as much as life as possible. वो intent थोड़ा different है, ये intent थोड़ा different. तो stage 3 is obviously treated more aggressively. Stage 4 are treated it less aggressively because we have to think about patient's health also. क्योंकि बट ये अगर लाइक आपने जैसे बोला लाइक स्टेज 3 स्टेज 4 कौन से कैंसर में आ रहा है दैट आल्सो मैटर्स अ लॉट. लंग का स्टेज 3 स्टेज 4 इज डिफरेंट. ब्रेस्ट का स्टेज 3 स्टेज 4 इज डिफरेंट.
ओके।
ब्रेस्ट का स्टेज 3 still can be cured properly. Stage 4 on the other hand, the patient if it has a good like hormone status, IHC status, patient can survive for 6-7 years. Recently, I think 2 weeks back ago, only I saw a patient that patient is my sir has treated that patient 10 years back. That patient came now with stage 4 breast cancer. So patients are surviving that long. So it is good for breast. But on the other hand, lung is a tiny bit aggressive tumor. So lung ke liye stage 4 ka the whole intent. First of all, I explain my patient is that they should be confident. If they start losing hope that this is stage 4, that the patient won't be surviving. So what should I do? Because all of a sudden the diagnosis also sometimes give them a lot of emotional turmoil. Like कैसे deal करे, how to look forward. But the thing is, right now the medical system has evolved a lot. I'm again and again saying this. So there are all options. Like I will say, our medical oncology colleagues bloom at stage 4. They are the master of the stage 4. They have immunotherapies and targeted therapies right now. They have excellent drugs right now. Yeah, they are very costly. That is the only problem because they are still coming to the India and they're still like manufactured by international brands. But if somebody is spending on those drugs and they have now, and we have genetic sequencing right now. पहले हम लोग कीमो दे देते थे. ओनली कीमो कीमो का बहुत ज्यादा साइड इफेक्ट होता है. अभी स्टेज 4 के लिए वी हैव इम्यूनोस एंड टारगेटेड थेरेपीज. They are
ओके।
very beneficial for certain cancers. Like lung cancer के लिए immunotherapy works like a charm. Immunotherapy and targeted therapy. The patient lifespan earlier the lifespan used to be very less, 3-4 months. Right now it has gone like 2-3 years also patients are crossing. 2-3 years, 4 years also patients are crossing sometimes. So the thing is the patient should be the mindset should be very clear that all the teams how to go for it weekly checkups. ये बहुत hectic होता है कभी कभी. This we never can understand until and unless somebody is going through it. Like बार बार 3 months बाद फिर से आना, फिर से कीमो के साइकिल्स लेना, फिर से इम्यूनोथेरेपी टारगेटेड थेरेपी लेना. कभी कभी विल रिकमेंड रेडिएशन ऑल्सो फॉर सम इट इज ब्लीडिंग और नॉट. So all those things, the patient should stay strong and listen to the doctors, and they should go to a proper oncology setup. This is another recommendation because in oncologists all over the India, they are treating very wonderfully. What I have noticed, but sometimes they will go to some. other hospitals, they might not be as updated as oncologists, cancer specialists. So other,
Mhm.
like, only if the center is dealing with a lot of cancer patients, they should go to that patient. They go to that doctor or that hospital, because then they will know what they are doing. Because every what I told you, Tina madam, like every single month the treatment is changing. The doctor needs to be updated fiercely. He needs to read every single day. Then only he will know, like, what, if I stop reading for 1 year, another two drugs will come.
Correct, correct, absolutely. Wow, great. So basically, we got lot of hope because cancer is treatable, right?
Yes,
अगर
yes. Right now it
आपको
is treatable and also preventable.
या सो आपको ऐसा कोई स्टोरी याद है, कुछ स्टोरी जब आप किसी ने ओवरकम ओवरकम किया कैंसर, यू नो?
Uh,
और
Actually, lot of patients are there like that. They occasionally come for like 5 years, 6 years. See, I am still not in the field that much time. I haven't been in the field for 5 years right now, so I cannot say. Like, I am also very new to the field. I'm just came, so I'm just exploring, still exploring. But from my experience, so I have seen a lot of people surviving for 2, 3 years. But like, I see some old patients sometimes, like they are treated long back. They are coming. They come with a lot of hope. They remained very strong during the whole treatment. I told you, a stage 4 patient is a dancer in Mumbai, still practices dancing, still is wonderfully dancing. I just met her last week. So she's still doing absolutely great. She has stage 4 cancer with multiple bone में spread हो चुका है उनका cancer. But still she's taking daily, monthly medications, hormone therapy is still going on. Still she's taking the bone solidifying agents. All those things are going on. She is doing great, and other patients are also there. Some brain small benign brain tumor patients are also sometimes come. Prostate cancer patients are coming. Some tongue cancer patients who, like, young patients and undergone surgery, radiation, everything. They had a big surgery. Still they're doing good 5 years, 6 years. Lot of them are there right now.
wow, wonderful. So yes, I think though you told you have very less experience, but whatever you shared is really a value add. You know, yeah, बहुत ही बहुत help होगा. You know, as a common person, क्योंकि मुझे भी नहीं पता था कि what is stage one, stage two, stage three. We have no idea as a common person, है ना? पर जैसे आपने बताया, you know, and stage three तक curable हो सकता है. Stage four also है ना? Because of medical facility आजकल काफी survival rate बढ़ चुका है, क्योंकि अभी हम सुनते रहते हैं ना, कैंसर survive हुआ है, कैंसर,
हाँ,
या तो ये स्टोरीज काफी अभी आ रहे हैं, यू नो, इंटरनेट पे एंड और सोशल मीडिया पे, सो दैट ऑल्सो इज ग्रेट. सो नाउ लास्ट थिंग विच जो मैं आपको एज अ डॉक्टर यही पूछना चाहूंगी कि व्हाट विल बी योर मैसेज, यू नो, आपका क्या मैसेज रहेगा फॉर अ जनरल पीपल अबाउट हेल्थ एंड पीपल हु आर बैटलिंग कैंसर, दोनों के लिए अगर आप यू नो यू कैन गिव मैसेज एज अ डॉक्टर, क्योंकि
for
बहुत
for general people, I will definitely say, at least if you're having some amount of symptoms, get it checked. Get it checked, get it checked, get it checked. Because as early as possible, if the thing gets diagnosed, the treatment not only becomes easy for you, it also becomes easy for the doctors. First thing. Second thing, like, we are talking about obesity, we are talking about health from day one itself. Like, your whole channel is about promoting good health and great health and stopping obesity. People
yes.
sometimes, like, they will ignore the obesity, like saying that we'll do it tomorrow, kal karenge, parso karenge. I still like believe that whenever they think that they have gained some weight, they should reduce, because losing weight is under our control. Genetically, if your mom had cancer, there is a chance of you getting cancer. That is not under our control, but definitely the weight loss is under our control.
Mhm.
And for somebody who is battling cancer, I will just recommend you guys to stay strong. Whatever the stages you are, how whatever the treatment is going, if the doctor, you have the trust to the doctors, just trust the doctor, trust the whole process, and just go through the treatment. You will definitely get some results. And there are multiple other options also. And again, just get treated in a better oncological center where all the specialties are there, they're experienced doctors. Treatment changes a lot based on the place where you are going. If it is not a cancer center, the way they treat the patient, if it is a cancer center, the way they treat the patient is completely different. Because the everyday seeing same thing helps you to know more actually.
Mm,
So
yeah.
this,
Thank you so much. You know, I think you have
it was my pleasure.
no, it was a great session, really, you know, whatever you shared. And thanks for coming. And as I told you, know, it was great to have you here today, Dr. Abhilash. And we'll definitely, you know, invite you maybe in future
Sure,
again,
sure.
you know, empower our audience. So thank you so much. And yeah, goodbye. या सो गाइस, आई होप आपको हेल्प हुआ इसके पॉडकास्ट से, और जो मैंने भी आज सीखा या जो मैंने उनसे समझा कि कैंसर कैन बी प्रिवेंटेड, वो हमारे हाथ में ही है। रॉन्ग लाइफस्टाइल, रॉन्ग फूड हैबिट्स, हम ऑल ऑफ यू या ऑल ऑफ अस, वी नो कि अगर हम गलत खाना खा रहे, गलत लाइफस्टाइल लीड करें, हमें पता चल जाता है, राइट? कि क्यों, कैसे पता चल रहा है? हमारा बॉडी ऑटोमेटिकली सिम्टम्स दिखाना लग जाता है, हमारा वेट बढ़ने लग जाता है, या हमें इंडाइजेशन होने लग जाता है, या वट एवर, एज डॉक्टर टोल्ड, लॉट ऑफ सिम्टम्स है ना। सो किसी भी सिम्टम को इग्नोर नहीं करना है, फिजिकली, मेंटली, एनीथिंग, वी शुड नॉट इग्नोर एनी सिम्टम जो हमारा बॉडी हमें दे रहा है, राइट? सो आई होप दिस पॉडकास्ट हेल्प यू, दिस कन्वर्सेशन हेल्प यू, है ना? और हम वी इन फ्यूचर ऑल्सो वी विल कीप कमिंग अप टू हेल्प यू विथ अदर टॉपिक्स। अगर आपको कोई भी टॉपिक में पॉडकास्ट चाहिए, जरूर बोलिए। हम वैसे डॉक्टर्स को कांटेक्ट करके आपके साथ लाएंगे, और आपका क्वेश्चंस भी, आपके मन में अगर कोई क्वेश्चंस है तो डेफिनेटली यू लेट अस नो, विल ट्राई टू हेल्प यू आउट विथ गेटिंग द आंसर्स। ठीक है? सो थैंक यू एवरीवन, to be a great audience. I hope we added value today. And so signing up for today. Bye bye.